Hello everyone, welcome. I'm just testing that we can hear me and everything. Mommy MOT will be coming up in a moment to let me know they can hear me. Can you give me a thumbs up if you can hear me all right? Is the sound coming through? Hello everyone, have we got sound? Just need to know that you can hear me okay. Brilliant. Hello. Oh, brilliant. Was that a thumbs up to say you can hear me? Perfecto. Brilliant. Welcome. Oh, thank you for confirming. Hello. It's so lovely to see you. Well, I can't see you, but I can see that your names are coming up. Hello. So we're waiting to just get started. Oh, thank you. That's really nice. Thank you for letting me know. I was worried that we were going to have sound problems. Thank you. Fabulous. Thanks for joining us. I'll wait a few more moments and we'll get started on a little bit of a talk. Hello. About returning to running after having a baby and the importance of safe and effective rehabilitation for that. So I will give it a few more minutes because I think I joined us a little bit early. Hello. But yeah, what a lovely sunny evening to be going through a little bit about returning to running after having a baby. And at the end we'll be going through some questions. So at the end of the approximately half an hour talk and a bit of a practical, if you'd like to join in with some exercises, there'll be a chance to pop some questions on the end. Davina, do you want to give me a thumbs up when you want me to start? Do you think about 7:30? Is that now? You let me know. I'm ready to start when you are. I have my models of the pelvis here and here. And I have my trainers on, ready to go through some nice impact tests, some nice strength tests, and some good reasoning, perfect, about returning to running after having a baby. Fab. So, welcome to Instagram Live with the Mummy MOT. I'm Layla Holmes and I work at Physioadvantage. My business is based in Cofton Hackett in South Birmingham, and I'm a women's health specialist physiotherapist. I deal with muscle and joint injuries, so sports injuries, and then I also I specialise in women's health physiotherapy. Coolio. So I've done my physiotherapy degree and I've also done a master's degree in women's health physiotherapy. I did the first ever Mummy MOT course with the fabulous Maria Elliott. So I've been doing the Mummy MOT for about 5 years now and thoroughly enjoy doing and going through safe and effective postnatal rehab. I have 2 children of my own, 2 boys, 6 and 3.5, and I love running. So it's also something very close to my heart. So I love running, as you all probably do, or have started to love running. I love the fresh air. Oh, hello, female fitness coaching. I love the fresh air. I love the freedom, the headspace, and I love the endorphin release and the benefits physically and mentally that running gives us. Yeah. And particularly at the moment on lockdown, we have that one time a day to go and get that fresh air, that's headspace, that exercise. Running kind of ticks the boxes at the moment, doesn't it? So let's really go through how we can guide ourselves safely and effectively to do that, okay? Because our bodies go through a lot during pregnancy and it's important that we don't just go and put a lot of impact through our bodies, okay? So as you're probably aware, running is a high impact sport and it does ask a lot of our bodies. And because pregnancy and childbirth weaken and stress our bodies, we need to ideally give the body time, regain strength and prepare our bodies to run, okay? We have to be a little bit evidence-based as well, obviously, and we know that high impact exercise has been found to put a 4.5 increase risk of pelvic floor dysfunction through the pelvic floor, or put you more at risk of pelvic floor problems 4.5 times more likely than low impact exercise. That's not to avoid high impact exercise at all. but it's just to be aware that high impact exercise does put the pelvic floor under more strain. Okay, so if we think about what happens during our bodies during pregnancy, so this is our pelvis, this is the center of our body. This is where a lot of changes occur during pregnancy. So what we have to really think about is, so this is the pelvis, if you're not really familiar with the structure. So here's the pubic symphysis pubis joint at the front, the pubic bone right here in between the legs, yeah? Here is the pelvic floor muscles. Here are the pelvic floor muscles, sorry, which span the complete pelvic outlet, so underneath us completely from the pubic bone to the tailbone at the back and then span out to the sides, okay? So that's our pelvic floor, literally at the floor of our pelvis, okay? Now at the back here, we have our sacrum and our tailbone, our coccyx, and here are the pelvic bones, the ilium. So these are the sacroiliac joints, okay? So your sacroiliac joints and your symphysis pubis joint make up your pelvic ring, okay? So this is your pelvic girdle, and here are your sockets for your femurs, for your legs, okay? So one of the most important roles of the pelvis that we need to think about when returning to running is the fact that it helps that weight transfer from side to side, and it controls that. When you put one leg down, then the other, we need really good control around the pelvis. Now, that's important to take into consideration because we've had lots of changes around the pelvis during pregnancy, like we just said. So the most really important, valuable ones to think about are the muscle changes around your pelvis. So your muscles have naturally thinned, weakened, and got less tension around the pelvis. So your abdominal muscles come here. So they wrap around the pelvis here, attached to the top and around to the spine. Okay, they naturally get bigger during pregnancy. As you see, your baby bump grows, and that's to accommodate the growth of your baby. But your pelvic floor muscles also stretch as the weight of baby puts pressure through the pelvic floor and therefore allows some stretch through the pelvic floor. So the first thing we need to think about is the fact that your pelvic floor muscles, your abdominal muscles have stretched during pregnancy, regardless of how you deliver. So naturally, the muscle control is altered after you've had a baby, okay? So we need to rehabilitate these muscles back to function. We also have to think about the fact that hormonal changes during pregnancy cause the structures that normally support these joints in the pelvis, the symphysis pubis joint and the sacroiliac joints primarily, if we're talking about these around the pelvis, they relax due to the increased levels of relaxin. And that's okay, the body's designed to do that. But again, that means therefore that the control system and the support system around the pelvic floor and the pelvis, is altered. So when we've had our baby, we need to consider rehabilitating these muscles so that they can function properly to withstand that load and impact through the pelvis. So what's important to think about is we often get the question, well, I'm 6 weeks postpartum now. I've been to my GP. I'm going to start running. We've got to look at the fact that the 6-week check and the 6-week mark isn't the green light that everything has healed. Okay, we have to look at the natural healing times of our tissues as well before we start putting extra load through them. Okay, so we've got to think about the fact that if I just show another model of the pelvic floor, so this is the tailbone at the back, the pubic bone at the front, and we know that what we call the levator hiatus, so the area of the pelvic floor, widens during pregnancy and increases significantly after vaginal delivery. And in vaginal delivery, it's thought that it returns to a similar size at about 12 months postnatal. So that's something to take into consideration. Also, if you've had a cesarean section, like I said, your pelvic floor will have been stretched during pregnancy anyway, so it's important that you rehabilitate those muscles well. But also with a cesarean, we have to think about that natural tension that's got to get back through the abdominal wall. Okay, so naturally, if your muscles are normally like this, as your baby grows and your abdominal muscles stretch, the natural tension through your abdominal wall is less. And research has shown that approximately we gain about 73 to 79% of that tension, that tensile strength, back at about 6 to 7 months postnatally. Okay, so taking that into consideration, let's be aware that our tissues, our muscles, need longer to heal than that 6-week mark. So we have to work with our body's natural healing times as well. Okay, I often quite like in clinic to just give the visualization of what happens to your abdominals during pregnancy. You're probably aware of what we call a diastasis, maybe, which is a thinning of the linea alba, which is the connective tissue in between the muscle bellies of your rectus abdominis muscle, which is the superficial layer, the muscle on top of your abdominal wall. Now, it's normal for 100% of women during the final stages, the last stages of pregnancy, to have a widening there, okay? Because if you imagine this is your normal abdominal wall before having a baby, before growing a baby, and then it naturally stretches during pregnancy, therefore there's less resistance through your abdominal wall. And we have to make sure that we consider that when we're rehabilitating around the pelvis, okay? We can consider that sort of analogy when we're looking at the pelvic floor muscles as well. As you've had baby weight growing on the pelvic floor, there's naturally less tension through the pelvic floor, okay? I sometimes like to speak of what the muscles go through during pregnancy and childbirth as we would a sporting injury. So say if you were to really overstretch your bicep muscle, sprain your bicep muscle, or get a big scar through your bicep muscle, you would naturally allow that time to heal. Then you would potentially mobilize it, then gradually load it with strength and resistance in a graded manner. You wouldn't necessarily, well, you wouldn't ideally go straight to lift a 5 kilogram weight in that injured structure. It's similar for our bodies after childbirth. We have been through a significant event. The muscles have gone through a lot around the pelvis, and the pelvic ligaments and support system all needs to be rehabilitated with really good control. Okay, so it's really important to try and understand that, because I very much understand the nature of wanting to get back to high impact exercise as soon as possible after having a baby. I really do. So it's good to know. So what do we need to do then in the first 3 months postpartum if we're saying that we have some very good returning to postnatal running guidelines by 3 fabulous physiotherapists? And if you don't follow these physios already, I recommend that you do. If you like running and you're into postnatal rehab, these accounts are really good. So they're the running.physio, Tom Goom. He's written the returning to postnatal running guidelines, as has Absolute Physio, who's Granier Donnelly, and as has Physio Mom UK, Emma Brockwell. And these, I should have printed this off in colour. It would have looked a lot more beautiful, but I don't know why. We're back again. Fab. So, yeah. So in these guidelines, they recommend, due to the healing times that our bodies need to go through, our tissues need to go through, that we allow about 3 months before we start getting into high impact activity. Now, what's important with guidelines is that they are just that, they are guiding us. No 2 bodies are exactly the same, and it's really important that we don't compare postpartum rehab. No 2 people have had the same pregnancies. No 2 people have had the same deliveries, and no 2 people have the same bodies before having a baby, or the same past medical history, or the same previous sporting history, for example, or fitness levels. So we can't compare and directly have a recipe for everybody after having a baby. So it's always important to have that individualized postpartum rehabilitation, and follow these guidelines, but still reasoning what we need to take into account at each stage of your rehab. Some people, we might need to wait a fair bit longer than 3 months to start impact through the pelvic floor. Right. Fab. Oh, I think I'm back again. I wonder if you could still see me then. I'm not sure. So yeah, so some people might need to wait a lot longer than 3 months to start higher impact exercise. And that's okay, okay? We're all built differently, and we all have our own individualised goals. Some of us might want to do a 10-minute jog around the block. Some of us might want to get back to doing marathons. We all have our own goals and our own bodies to rehabilitate. So just to take that into account, I'm going through a generic outline as to returning to rehab after having a baby, but we recommend that every lady who's had a baby has their own individualised postnatal assessment. And that's in the guidelines as well, because it's really good to tailor your rehabilitation to your specific needs and have your muscles specifically assessed to suit your goals. So that's why we recommend ideally a mummy MOT, which goes through looking at all those muscles that control around the pelvis. So we'll talk about these a lot when I'm going through some nice exercises with you during this talk. Okay, so we need to look at your breathing control, and we go through that with your mummy MOT, your pelvic floor function, so that's assessed, and your abdominal wall tone and tension and function. Okay, and these are all really important to assess individually and see how they coordinate together and see how they control the pressure throughout the abdomen. Okay, so what do we need to look for? First of all, what are the key signs of any problems with the pelvic floor or abdominal wall problems? So these are symptoms that you really don't want to start running with. And throughout rehabilitation, if you get any of these symptoms, we need to grade back your rehabilitation a little bit. So the roles of the pelvic floor, if we think about where they are and the openings that they surround, we can think about their function. So the pelvic floor muscles surround the back passage. So they surround where we poo and where we pass wind. They surround our vagina, so where we have babies and where we have intercourse, and they surround where we wee out of. Okay, so they therefore control the back passage, vagina, and the urethra where we wee. So if we have any symptoms where we're leaking urine, then we don't start running yet. We know that there's a sign that there's a little bit of pelvic floor weakness. Any signs of leaking out the back passage, so fecal incontinence, leakage of poo, or passing wind. If we have any bulging, heaviness or dragging, lowering, heaviness in the lower abdomen or the vagina, then we know there's possibly less support through the pelvic floor. So that might be a little bit of a sign of a pelvic organ prolapse. So we need to build up the tension back in the pelvic floor. Also, if you're having pain during intercourse, it might be a sign that you've got a bit of weakness in the pelvic floor, maybe a little bit of overtension in the pelvic floor. So ideally that would be addressed individually with a women's health physiotherapist as well. Also, if you think about the abdominals as well, if you have any abdominal dysfunction, you might find that you have a doming tummy. Maybe when you go to sit up, maybe when you lift your leg up, and you get a bit of strain and pressure through your abdominal wall. Or you might find that you get a ridge in between your tummy here, or you might have a bit of a pendular tummy. And that's where we know the pressure throughout the abdomen isn't being necessarily well controlled. So for rehabilitation back to running, we need good control around the tummy, pelvic floor and abdominals, and any problems around those areas, namely incontinence, heaviness or bulging down in the vagina or lower abdominals, any straining through the tummy or changing in shape in the tummy, then we know you're not ready to start running. Okay, and regardless of whether you do have those symptoms or not, it's important that we go through the strength and loading tests around the pelvis so that you know that your pelvis and your pelvic floor is strong enough to withstand the impact for running. Okay, so first of all, what can we do in the first 3 months after having a baby? We've said ideally we're not doing high impact exercise, But what should we be doing then? So again, this is outlined beautifully in the postnatal returning to running guidelines, but we can try this now all together if you want to. So in the first 2 weeks after having a baby, what can we do? We can start getting good control and good movement around these core muscles. So around the diaphragm where we're breathing, around the pelvic floor, and around your abdominal. So we start effective breathing control. First 2 weeks postpartum, nice gentle mobilization and breathing control. Breathe in through the nose, belly rise, breathe out through the mouth. Beautiful. And then we can also start some gentle pelvic tilts. This gently starts to move the pelvis, alters the strain and pressure through the lower back. That takes the strain and alters the pressure off the pelvic floor, gets a bit of length and tension and activation started to take place through the abdominal. So pelvic tilts, breathing control in the first 2 weeks. Perfect. Starting to activate, wake up these muscles that have been stretched and lengthened and maybe had more trauma and scarring through. Okay, brilliant. So then we're looking at what can we do week 2 to 4 then. So we were going to progress your pelvic floor and your walking. Okay, walking can happen straight away as long as it feels comfortable to you and you don't get any of those pelvic floor dysfunction symptoms. So I'll talk you through a basic pelvic floor contraction, but again, this needs to be gone through with a women's health specialist physiotherapist so you know you're doing it properly, ideally. So thinking about the 3 openings down below, and you're always in pelvic neutral. So not fully rocked back, not fully lifted. You keep your pelvis in that lovely middle position with great breathing control. So to do a pelvic floor contraction, we breathe in through the nose, belly rises, breathe out, and we close all 3 openings down below, starting from the back passage as though we're trapping wind, then close the vagina, then close the urethra at the front. And we want to ideally think about closing them and pulling them towards the belly button because we want to close the 3 openings down below, lift them and move them forwards a bit. So because we know we want the pelvic floor to do this movement when we contract it, okay? But we still need to breathe. So we breathe in, breathe out, pulling through the pelvic floor gently, and we're still breathing, yeah? And then relax, good. So that's a slower contraction, gently up the elevator, and then relax back down. For returning to running, I'll go through the length of hold that we need to maintain, to ideally maintain to get back to higher impact sport. We need to be able to maintain at least a 6 to 8 second hold, at least 10 reps, and then 10 fast twitches. And the fast ones are important when we cough, sneeze and jump. You get that fast pressure down through the pelvic floor. So they're the pelvic floor muscle contractions that we need to go squeeze, let go, squeeze, let go. Okay, and those can be started gently straight after, in the first few weeks after having baby. But what we need to focus on in the first 3 months is functional rehab, so squats, lunges. When we get to sort of week 6 to 8, we can start power walking, putting more pressure down through the pelvic floor as you're getting faster and then putting more impact through the pelvis. Then what we can do is add in a little bit more core and lower limb work and maybe a little bit of resistance, for example, deadlifts at about a 6 to 8 week, and then 8 to 12 weeks swimming and spinning and things like that. Now, what I'm really keen to make us all aware of at the moment is when we want to do all this higher impact activity, we want to get back to running, we want to get back to jumping and things like that, because it makes us feel like we're really working out. That lower impact exercise doesn't necessarily mean low intensity. And I wanted to maybe go through a few exercises to show you that right now, if that's okay. So we're going through the first 3 months of postnatal rehab. Ideally in standing, you find pelvic neutral and you're practicing some nice controlled squats, body weight through the heels, keeping your spine in a good controlled position. You're not rounding at the upper back or the lower back, pulling in through the pelvic floor, okay? Now with that, hopefully you can see my feet as well. What we can do is also go into lunging control. So you've got good pelvic control in a lunge, so that in a split stance, which we need to get in for running, you have good pelvic control, okay? These can all be done within the first 3 months as long as you're not getting any symptoms of pain or pelvic floor problems like incontinence of urine or feces or heaviness or dragging or bulging like we've discussed, okay? And lunges on both sides equal out. You might find one side is more controlled than the other, and that's very normal, okay? Then what we can add is some resistance, maybe with a few deadlifts. So that's sliding down and coming back up the legs. And these are really important when we've got to hover over a cot or hover over the Moses basket. But we're trying to think about, we're trying to think about, you can't see my feet, thank you, Bells. We're trying to think about the fact that you can lean over, keeping a good pelvic and spine control. So with those in mind, they're fairly static. I hope you can see me a bit better, because what I'm going to do now is, ideally, we're going to do some more intense low impact exercise examples. So these are the things that you can try and do to get a little bit more resistance and impact through the pelvic floor whilst you're trying to rehabilitate your pelvic floor without necessarily jumping and hopping just yet. So we can go down into a squat, warm up into a squat, for example, gently pulling in through the pelvic floor throughout. Yes, we should squeeze. We're having a gentle pelvic floor contraction throughout. Good question. Yeah, always a baseline level contraction throughout the movement. Perfect question. Now, what I would like with these movements now is, as we come onto the tiptoes, you can do a fast twitch. So you can squeeze, squeeze. So you do a faster twitch with coming up onto your tiptoes. Yeah? So you can do 4 slower, controlled lunges, squats, sorry, and then 4 fast twitches with heel raises. And you can see straight away that's starting to get your cardio up. You're starting to train your pelvic floor more, putting a little bit more load through it. As you want to, you can always add in some arm movement as well to increase the intensity. So we can do that again in a lunge position. So you're lunging down and back up. Love the tip. Yeah, thank you. So coming down and back up in a lunge, body weight down and up. We're not leaning forwards in a lunge, we're coming down and up for good pelvic control. It's the basis of a run, okay? So that's where we need to rehabilitate that pelvic control. Again, we can do it static for about 4 if you'd like. These are examples of the things that I can give in little HIIT workouts to really make you feel like you're training, and then come up onto your tiptoes. And we can reach onto the tiptoes with fast squeezes through the pelvic floor, okay? So we're still getting a good workout. Thank you. Lovely. And another thing that we can also try and do, I hope you can see my feet all right, is we can try some twists as well. So you can already feel that your heart rate's getting up, which feels quite nice in the first few stages of having a baby. We really want to feel like we're working hard. But what's quite nice maybe is I quite like a bit of a reverse lunge and then a twist. Reverse lunge, then a twist. Again, you're squeezing through the pelvic floor throughout the movement. Squeeze. And if you see the movement forwards, you can see, oh, that's what we kind of need to do to run, yeah? So we're coordinating movement patterns as well. Squeeze and squeeze. We've got that gentle baseline pelvic floor contraction, great pelvic control, and you're getting a good workout. Well, I feel I am. So these are the type of things that we can do that really give you a good workout. You're not yet out there running, but you're really strengthening around your pelvis, okay? So I will take a deep breath. I'm glad you tried it, Burls. I hope you did find it hard. Risk factors for potential returning to running. So what are the other things we need to maybe take into account when we're looking at returning to running? So Are you 3 months postpartum or not? As we've discussed, because we've looked at the healing times of what the abdominal muscles and pelvic floor muscles need to go through. Do you have any pre-existing hypermobile conditions? Because that means you might be a little bit more stretchy in your joints. So that means that your joints are more predisposed to being put under a bit of strain. So we really need to make sure you've got fabulous muscle control, good positioning of your joints throughout your pelvis and your lower body. It's really important that we're loading the whole lower limb properly, and that control comes from the pelvis. So we need to take into account any previous injuries as well. So we also need to take into account breastfeeding. Are you breastfeeding still? That's absolutely fine. I breastfed for ages and ran throughout that. That was absolutely fine. But there's no concrete evidence to show really with breastfeeding just yet. But we do think it does impact the hormones in such a way that it does increase our sort of ligament or joint laxity. It's something to consider. These are considerations. Do you have previous back pain or pelvic girdle pain? Are you classed as obese? Because we know that pelvic floor dysfunction, you're at more increased risk of pelvic floor dysfunction if your BMI is over 30, for example. And if you've had a C-section or perineal scarring, we've got to think about the scar tissue. When we have a scar, it's like having a piece of twined rope in an elasticated muscle, and that therefore affects the slide and glide and tension of those tissues of the abdominals and the pelvic floor. So we need to make sure that we work through those and take those into consideration with good exercise around the abdominal wall and the perineum, which is the hub of the pelvic floor muscles here, where we can get scarring with childbirth. And we can also do lots of abdominal massage in clinic as well. So bearing in mind I'm saying all of this about having your own individual assessment after having a baby. A lot of us women's health physiotherapists are doing virtual clinics at the moment, which are working really well. So WhatsApp video, Zoom, Skype, Messenger, all of them, and we can do such a lot, so you're not alone. Okay, so a few things also to consider, that was if you're looking to return to running. Now, subjectively, what do you tell us as women's health physios when you want to return to running? What are we looking out for? So we don't want you necessarily to run really or start running if you've got any urinary, so any leaking of wee or poo prior to or during commencement of running. Then we ideally don't want you to start running just yet. If you have any pressure, dragging or bulging down below, that can be an indication that your pelvic organs are lowered a little bit or lowering. That's your pelvic organs, your bladder, your bowel and your womb. And that's a sign that we need to increase that support of the pelvic floor so that we get that tension back to reduce that lowering and that dragging sensation. Also, if you have, when you're not to run after having a baby, if you have ongoing or an onset of vaginal bleeding, not in relation to your menstrual cycle, during or after attempted low impact or high impact exercise, okay? Also, when not to return to running and get some advice from a women's health physio, it is if you have any muscle or joint pain prior to running, okay? So that's not saying you should never run if you have any of those things. It's saying let's get a little bit of specific rehab to address those symptoms and then grade you back to running, okay? So objectively, so these are the things, these are the measures that we're looking at, and these are the things that I find when rehabbing people, they really like objective measures to be able to say, yes, I can do that. Yes, I can do that. I'm ready. Because it makes you feel like your rehab is really quite structured. So objectively, what are we looking for? Now, in alignment with sort of the returning to running guidelines that we have, this fabulous postpartum returning to running assessment score sheet has been devised by, I do believe it was My Pelvic Floor Muscles. It's a fabulous sheet and I use it with ladies in clinic, and it separates the rehab the objective measures we're looking at for you to be able to do before going back to running into 3 sections. So one is, I think I look at it broadly speaking in 3 sections. So your pelvic floor muscle strength and control, and your strength testing of your lower limbs and core, and then your load and impact management through your pelvis. So those 3 areas, we're looking at pelvic floor, the other muscles involved around the pelvis that are important in controlling that movement when we're running. So these namely are your glutes. Yeah, we're looking at your glutes, your quads, your hamstrings and your calf. So that's a lot of that tiptoe control we were doing, okay? Your calf training. Then the load and impact management. I've spoken about how the pelvis is involved in taking the weight from one side to the other. So we need to be able to see how your pelvis can load that weight and how it can control that weight transfer from one side to the other, so that when you do go and put extra impact through it when you're running, that it's not putting any excess strain or sprain through the structures in your pelvis, and it's not putting undue pressure through your pelvic floor or your tummy or your abdomen. So with your pelvic floor muscles, what we're aiming for before you go back to running, ideally, is you can do 10 fast reps. So that's a squeeze, relax, squeeze, relax, squeeze, let go, squeeze, let go. 10 of those, and then 8 to 12 reps of a 6 to 8 second hold. So that's that. Breathe in, breathe out, close through the pelvic floor. So that's the back passage, vagina, and then the urethra at the front. Pulling it up towards the belly button. Keep breathing. Hold it for 6 to 8 seconds, and then relax. And be able to do 8 to 12 reps of those. Now that's quite tricky, that's quite hard, and it's really useful to go through being able to control your pelvic floor and activate your pelvic floor individually, because it's well known and it's well researched that a lot of us think we're doing our pelvic floor correctly, but we're not. We might be bracing, we might be pushing down, we might be straining, holding our breath, which creates a channel of pressure down through our pelvic floor, which is what we don't want. So it's always important to try and get checked out to make sure you're doing your pelvic floor exercises correctly, okay? So let's look at the load and impact management assessment that we need to try and do to show that you are ready to return to running. Now, if you can't do these tests, it doesn't necessarily mean that you are not going to be able to return to running, or it's also a really good gauge as to where we need to work, what we need to work on. Is it your balance and control on one leg? Is it the way you are moving forwards and backwards in your running move? So it's a really nice way to tailor your exercise program sometimes as well. So the load and impact management assessment and all of these objective measures need to be that you can carry them out without getting any symptoms of pelvic floor problems. So no urinary incontinence or fecal incontinence, no dragging or bulging or heaviness through the vagina or lower abdomen, and no pain around the pelvis or any other muscle or joint pain. Okay, so first thing is, can you walk for 30 minutes without any discomfort, any of those pelvic floor problems or muscle or joint problems? So that's the first thing. Then, can you balance on one leg for 10 seconds? Now, the important thing here is that we have good pelvic control here. The pelvis remains level. We have good stability and grounding through the leg. We don't thrust the knee back. And we stand on one leg, pulling in through the pelvic floor, and we can hold it for 10 seconds. Now, what you might find if you try and do this is you like to do this and hinge on that hip and hang from that hip. Or you might like to shift upwards to compensate. So what we really need to try and do is keep the shoulders and the hips in line and the legs parallel from the hips. Try not to let them angle in. Okay, really ground through that foot, pulling through the pelvic floor. And for returning to running, we would like a single leg balance for 10 seconds, okay? Because if you think about it, when we run, it's all about the weight transfer from one side to the other. So we need to know that that can be really well controlled. So then, and if you would like to try this, we can all do it together. It's the single leg squat, 10 reps on each side. So keeping the pelvis level, bending the other leg, we can try I'll try a dip for now, a little dip, bending at the hip. So like we did the squat, but we're just on one leg. That's tricky and it requires a lot of concentration. Again, we need good control around the pelvis and the abdomen as you come down and back up. Yeah, lovely. And we're trying 10 reps on each side. Lovely. And then you can see your glutes are having to work there. You're pulling in through the pelvic floor. You've got good balance, good strength, good loading through the pelvis, okay? That's, again, you can see how that translates into being necessary for your running, okay? Then we've got jogging on the spot without any symptoms of pelvic floor problems, jogging on the spot for a minute, yeah? With good breathing control. All of these need to be done while you're not holding your breath, okay? Not holding your breath or getting any symptoms that you don't really want to have, okay? So these are all in the first section of your load and management and load and impact management objective measures for returning to running. Then we've got your forward bounds, 10 forward bounds. Again, without any symptoms in the pelvic floor or tummy, is coming forwards and backwards. Well, we're going forwards and we want to be able to do 10 on each side with good control and no pelvic floor problems. Squeeze, lovely. So we're gently squeezing through the pelvic floor throughout, and as we're coming forward you can think about fast squeezing. Lovely, brilliant. So that's the forward bounds. Then we're looking at hopping, 10 hops on each leg. Now I'm going to do my left leg because it's not as good as my right, and I always demonstrate on my right, sorry. So let's go for this one. So we're hopping, 10 reps with good pelvic control. You can see when we start to hop, we might want to start to do this. Yeah, you can see how that's going to load awkwardly through the glutes, through that side of the hip, put altered strain down through the pelvic floor. So ideally we want good breathing, good control through the pelvic floor and abdominals for 10 hops on one side, okay? And no problems through the pelvic floor. Fabulous. Then, this is one of my favourite ones. It's a single leg running man. So, we ground ourselves on one leg and we take the leg backwards and forwards, backwards and forwards. And I always start off with a slight hover of the foot, forwards and backwards. And then I go to a bit higher as we feel more comfortable. Backwards and forwards, and that's a running man with good pelvic control, pulling in through the core. And as you get happier with the running man, you can start to tap the floor. Woo! Yeah, lovely. Again, both sides. I demoed on my right then because it's my favourite side. 10 reps on each side, okay? So that's the load and impact through the pelvis. That's what we're looking to get good in order to get you strong through your pelvic control to get you back to running. Now, the strength testing. We also need to make sure that the other muscles around the pelvis are nice and strong to maintain good function for running as well. So with this, we're looking at primarily your calves, your hamstrings, your quads and your glutes. So we're looking at your single leg calf raise. So we're looking for being able to tiptoe on one leg 20 times, one side, and then 20 times the other. With no pain, no discomfort, no problems through the pelvic floor. Oh, can you hear now? Can you hear now? Was I too far away? Somebody saying they can't hear. Can anybody else hear? And then a single leg bridge. Wow. Single leg bridge. I love a single leg bridge. I'm just going to show a single leg bridge. This is all about your glute control here. So lying on your back in a bridge and trying to pull in through your core. Breathe in, breathe out, pulling through the pelvic floor, tilt back and then push up into the bridge. Keeping good pelvic alignment and then slowly down. Lovely. Then lift up. Then slowly down. And you're looking to be able to do 10 reps on both sides. Brilliant. Okay. Then again, we're looking at your single leg control. Perfect. Thank you. going from sit to stand on one leg. So now we're looking at good quads, hamstrings and glute control. This is a really difficult one, I find, and it's so important to be able to not hold your breath. Oh, I do like a good thumbs up from all my pals. Oh, you babes. Okay. So what I want to try and do, standing on, using one leg to ground through, lift up and then come down. Oh, Bells can't hear. Oh, now can you hear us? Oh yeah, Bells can hear. Cool. So keeping good control through the pelvis, coming down and back up. Control through the leg. The important thing with this, I do find, is just not holding your breath, because as we find we're getting a bit more lower limb strain, we might find that clients want to hold the breath, go to do something. If you ever hold your breath when you exercise, you're creating a channel of pressure downwards, which causes strain through the pelvic floor or through the tummy, or sprain or strain through the back or the pelvis, okay? So that's another good one for your strength testing. Hello, Maria. So now we'll look at your glute control. You might have tried this exercise before. I'll go a bit further back. But now we're looking at glute control, just showing how when we're returning back to running after having a baby, we're not just looking at getting your pelvic floor stronger, then being able to hold your pelvic floor for a longer period of time, doing longer periods of reps with your pelvic floor. It's about your pelvic floor rehab, then making sure you can load through your pelvis well for that impact during running. And it's also then about rehabilitating and strengthening around the other muscles around your pelvis and lower limb, so that therefore you are not putting extra strain through your pelvic floor. So that's why it's important we piece it all together to ensure that that higher impact exercise is well controlled. Okay, so I'm just going to show you the sideline leg abduction, a really good glute control exercise. So hopefully you can see me. Woohoo! So keeping the pelvis level and lifting the upper leg up and back down. Keeping the legs stacked and the top leg goes up and down. Don't let it come forwards. Okay. And ideally, I like about 20 reps of these. 15 to 20 reps. Okay, so that's a good glute test. And like I said, they're all good ways to be able to target an exercise program as well to meet your needs with your running rehab. So they can all be adapted in a way, taken down a level if we need to work on the control. Thank you. To work your personalised exercise program. Okay, so those are the key points for returning to running and what we're looking for. If I just recap, when you're returning to running after having a baby, we want to make sure that ideally the higher impact exercise and running isn't started until you're about 3 months postpartum, due to the tissue healing and impact that we need to start putting through the pelvic floor if we are running. Okay, and I've given examples of lower impact exercise that can be still of a higher intensity and still be fun. Yeah, lower impact exercise can still be fun, and your women's health physio, your postnatal physio will hopefully, especially at the moment, be able to give you a nice low impact, but an intense HIIT workout, which I'm doing with a lot of my patients at the moment to keep you going whilst we're working on the returning to running rehab. So we're looking at, when we're returning to running, good pelvic floor control, so you can withstand the impact through the pelvic floor. Good load and impact control through the pelvic floor with no pelvic floor problems, and good lower body strength and control. Okay, and then after there, where do we go? Yes, we need to grade back to running. So what does that mean? Well, what that means is what's really useful way to start is the NHS Couch to 5K is a good way, starting with a graded program of sort of a 1 minute jog and a 2 minute, for example, faster walk. But those type of graded programs are really quite valuable. But again, it's really quite useful to speak to your women's health physio to see what is the best rehab and graded structured running program for you to start with. But Couch to 5K, the NHS app, tends to be quite a good place to start. So key points from today's session. My pelvic floor model, I feel, just jumped. Is that every woman ideally should see a pelvic health physiotherapist after having a baby. Get your individual body assessed and rehabilitated to suit your needs and your goals. And that's what a mommy MOT is there for. And if at the moment you're a bit concerned about this, just have a good look at the website. Have a good look at some really useful resources online. Some good women's health physios are out there giving some great information at the moment during lockdown. Please wait ideally till you're symptom free before you start running, okay? Because if we just blast through it, it's likely you will make your symptoms worse, and we just need to get that strength and function back. See it as a bit of a muscle injury, and when we've had a baby, our muscles have been through a lot and they need to be rehabilitated back to function. And it's that the pelvic floor muscle function is controlling the pelvis, and it also controls the bladder, the bowel and the womb, so it controls those sensitive functions as well. So therefore it's super important we rehabilitate them. Okay, start with a low impact exercise program, and remember, low impact can still be fun for us runners. We can still make it fun. Grade your return to running, and then as you're grading your running, still monitor your symptoms throughout. It's not just a case of going back to running and it'll all be okay. We're continually monitoring the symptoms and adapting things. Oh, thanks, Sharon. So I've discussed other factors that need to be taken into account. But just to recap, guidelines are there to guide us and aren't necessarily a structured recipe for us all. Okay, let me just have a little look at this question. Do we have a question? Come on, MOT, note down the 3 good physios you mentioned in the guide. Yes, of course, Blinky Schwartz. So the 3 physios that wrote the returning to running guidelines, I'm sure we'll post those for you, and the link to the returning to running guidelines. I did put them in one of my last posts, but I'll make sure we do that all for you. Okay, they're very, very, very good guidelines, and they can give you an outline structure. But please remember that whilst, even though reading those guidelines, have your own individualized assessment as well. Know what your body's doing. Okay, and also let's just think about, to finish off, a few other factors that we do need to consider for the postnatal population in general. Our previous fitness level. Did you used to run? Is running something new to you? So, what's your cardiovascular system like? Okay. Do we need to adapt and pace that back to your level as well? Do you have a diastasis? So I've talked a lot about pelvic floor function. I have spoken a little bit about diastasis and breathing control. But if you do have a diastasis, which is widening of the linear alba, the connective tissue in the abdominal wall, it is thought that this can interrupt the control of pressure throughout the abdomen. There's no definite research to show this. However, we need to make sure that we are aware that there has been a fine link between having a diastasis and possibly the presence of higher impact can be related a little bit to prolapse symptoms as well. So we need to make sure, if we've not got as good tension as possible through the abdominal wall, let's rehabilitate that too, because it's important to control the pressure, and we have the synergy and coordination of the muscles around the pelvis. Breathing. I've spoken a little bit about breathing, but I cannot emphasise the importance of good belly breathing enough, especially at the moment when we're all quite hyper anxious in this really interesting lockdown state. Breathing in and out. Oh, thank you. Yes, absolutely. Be kind to your body. We all want to blast out running because we love it, but well, that's if you do love it. But just be kind to yourself and allow your body to heal as well. Yeah, be gentle with yourself. But yeah, breathe in and out from the belly. Get good breathing control, so you're getting good pressure control through the pelvis. We've got to think about our psychological status as well after having a baby. Postnatal depression is very, very common. Okay, and we have to think that, is running there to help us mentally and physically? Can it be something we get slightly addicted to? Let's just have be aware of that. Mental and physical well-being are inextricably linked, and we need to really start making an awareness of that really acceptable and common. Okay, breastfeeding, as I've spoken about, can influence joint laxity potentially with the lower levels of estrogen, high levels of relaxin. Scar mobilization, be aware of any scars in your body that may potentially be restricting movement through your tissue. Good sportwear, good footwear, important. Sleep deprivation. Do you get much sleep when you've had a baby? I don't know. I didn't really. Thank you, Mim. So that it's known that decreased sleep in athletes can lead to an increased risk of injury. So be mindful of that sleep deprivation. Don't let it stress you out though. And also relative energy deficiency syndrome as well in sport. So yeah, I hope that's been useful. I've gone through quite a few different areas there that I hope it's directed you with where you would need to go to get back to running after having a baby. Make it very individual to you, but be aware of the need for that progressed and paced rehab to exercise at your level after having a baby, and the important need for doing that. Okay, the natural times that tissues need to heal and the level of impact that our bodies need to withstand and our muscles need to withstand to get back to running. It's really important to acknowledge that and grade your rehab back to be able to control and withstand that. If you have any questions, please do post a few up now. And I'll try and answer them. I have no idea how long I've been Mommy MOT, so please do let me know. I should probably sign off in a minute. But do let me know. And if you need any more information, please do check out the Mommy MOT website and their Instagram and Facebook. Please do check mine out as well, Physioadvantage on Instagram, Facebook, and get in touch if you'd like a virtual assessment, either with me or one of the other fabulous Mummy MOT practitioners. Okay, so does anybody have any questions? Do you have a link to somewhere we could find good workouts for repairing stomach muscles that have split? So again, this would be important to, I would say, assess your tummy muscles to see the level that you're at first of all before you were to be guided as to where to go to start your graded exercise program for your tummy muscles. Even if you were to maybe have a one-off physio assessment, even a virtual assessment, because we would be able to see what your tummy looks like in standing. We'd be able to see what it looks like as you move your back, as you move your legs, as you get into a hovered position, as you resist movement of your knees. We could get you to feel the tension throughout your tummy, see what it looks like, feel the gap through the tummy. Then go through the basics, first of all, of activating your deep abdominal muscle system. Because when we're rehabilitating your tummy muscles, we need to make sure we work the deep muscle system first. And it's important that individuals can connect with those muscles themselves and know they can do it properly before you go on to more generic programs. I hope that makes sense. Cherry Ebbs. But yeah, if you need more information, there is a good resource on the Mommy MOT website again, I do believe, on diastasis postpartum. Wow, almost an hour. Thanks, Bill.